More coffee.
All right, and welcome to our 8th week of regional report out calls. Hard to believe we've been doing this a couple months. It's February 2nd, also known as Groundhog Day. The groundhog told us we got 6 more weeks of winter to look forward to. Sounds like that's proper continuation of 2020 into 2021, only fitting. But we do have the Chiefs to look forward to this weekend, so we got that going for us. So first announcement is we're going to move these calls from every week to every other week. So there will be no call next week. We'll be on February 16th and then again on March 2nd as the numbers have continued to improve in both the case counts and inside the hospital capacity. State leadership has felt good moving this out, still making sure we want to touch base and know what's going on regionally with this and the vaccine rollout. And so you can mark those on your calendar. You can also, what I'd encourage you to do if you haven't already, is go to our website, covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. And just put in your email address, the Northeast region, and you will have the opportunity to have this sent to you on the 16th with the dashboard and receive the update. We're going to try and shorten these calls just a little bit so you can get the information you need and then go on back about your work of making your community great. And I'm going to get this set up to share the Northeast region here with you from a dashboard perspective. So let me get my screen shared. There we go. A lot of computer clicking going on here. Okay. Northeast region, February 2nd. 100% of the hospitals reporting still see a little bit of critical staffing issues. Again, there's probably staffing issues and inside of this, it's not captured that we've heard a lot about is just staff morale. People are tired. They've just gone through this surge, seeing more death than what they're used to, working more hours and covering more patients than they're used to. So we're going to start hitting a time when people need some vacation, some mental health breaks and things like that. But fortunately, capacity is coming down a little bit to provide for that. So when you come here to the hospitalized or confirmed suspected COVID patients here, this number was at 112 last week, 100 COVID patients. 3 weeks ago, this number was at 161. So you can see the drop. What I'm hearing consistently across the state, and this is generally, so it's in every hospital, but a lot of hospitals are finding themselves at 40 to 50% the number of COVID patients that they had at the peak, which is really good considering there's other reasons people need hospitals this time of year. Going to the COVID patients in the ICU, we're at 20 here. We've been at 21 the last 2 weeks, so that number's staying steady. And then coming over here for adult staffed ICU beds, 34 available. So the same number it was last week. So we got 31% of ICU availability, which is good. Didn't love seeing this number, where we're continuing to kind of click along here where we get a little better. The trajectory is still a little better week over week, which is the direction we want to go in. I'm seeing a steeper decline in other parts of the state. When you factor the Kansas City market into this, you do see a little bit of a steeper decline in the area. But there's still work to be done there in the Northeast region. I'm going to flip over here to the vaccine site, kansasvaccine.gov. Good place to go if you want to know what's going on with the vaccine. Click on data. They're going to roll out this Find My Vaccine thing tomorrow, I believe. But you go on data, and you can see we're continuing to make progress. I think this was at 4.5% last week, 6.4% this week. We're getting more and more Kansas vaccinated. It's 185,000 Kansas that have gotten the first dose. These numbers lag, so that number is probably higher. Fully vaccinated, almost 45,000. We did get a question from Scott in this region to our email address. If you ever have questions, please do email us at ksregionalreport@gmail.com. He was asking if the federal long-term care facility programs run through CVS and Walgreens is included in this number. It is now. It wasn't last week, but you can see that going out. I did hear from the Secretary of Health today that from his understanding, we are 3/4 of the way through long-term care patients across the state and are hoping to be through all of them by the second week of February. And that's a program federally contract with CVS and Walgreens to get into those long-term care facilities where we've had a lot of outbreaks and unfortunately a lot of death. So that's good that we're making progress there too. And I will say, we need to make this point a couple times. The issue with vaccine right now is not distribution, it is supply. So when you look across Kansas, there's over 800,000 people that are in the phase 2 category. And we're getting about, with the increase, somewhere between 60 and 70,000 a week. We've been at 45,000. And that's going to take a while because people need 2 shots of Moderna and Pfizer. And so patients, be checking with your local county to understand the process they're going through, and we'll hear more about that. But just want to make sure everybody understands it's supply. When we get it, it's generally getting out and in arms in 2 or 3 days. They have a real goal of making sure it's under a week from the time it arrives before it's in arms. So just putting that out there. Again, great stats on this page: age, Moderna versus Pfizer, shots per day, first and second doses, and then what you're getting, per county. Shawnee County, it's in this, right around 2,000 doses this last week. And there's a lot more people in that phase 2 that are anxious to get the vaccine. So there we go. Let me stop sharing. I've read through numbers and told that story, but I think it's important for us to hear from the people on the ground. And so let's go with Jenny in Douglas County to give us an update from public health.
So like you said, hospital-wise, we're doing pretty good. I would like to state, though, our infectious prevention team at Lawrence Memorial informed us that even though we are lower case-wise in the hospital, they're seeing some of the more severe cases of COVID that they have seen previously. So it's more intense, more sick people are much sicker. We may not have as many beds full, but they're still requiring a lot of care. Additionally, countywide, we are seeing a decrease in cases. I kind of want to caution people in understanding as well, though, that we're not testing at the same rate we were last month. We're not testing at the same rate we were the month before. We have more tests available than we've ever had before, but we're not getting people to test. So I really would like to push the gogettested.com website. It'll help you find available testing in your area, but it's really important we continue to test if you feel like you have any symptoms. And then another big thing that we're seeing is that, yeah, we don't have a lot of cases, which is great. We're happy to see that because that means people are social distancing. When they're meeting with people, they're meeting outside. But the unfortunate news is that the cases that we do have are mostly clusters. So a lot of what we're finding are related cases, which means they all saw the same person, and they're big outbreaks basically at this point. So we're seeing that people are not social distancing when they're with people that they trust, which is kind of a loaded term for anyone in public health at this point. It's not about trust. The disease doesn't care if you trust someone. The disease cares that it has opportunity. So wear your mask, socially distance, wash your hands.
Yeah, an important point, knowing that people are going to want to get together for the Chiefs game this weekend. And yeah,
open a window if you're going to be inside. That's my big thing is be safe, open a window, don't share your food, bring your own plate.
Yep. Good advice right there. Do you know, this may be a tough question to answer. So we've had college students come back in University of Kansas, K-State, both in this region. Mm-hmm. Do you think any of the increase in cases is just students coming back into this area?
Not too much. So KU does entry testing for all their students prior to coming back in. So that really does help our positivity rate. But if you look at our age distribution breakdowns currently, we're seeing more cases in younger kids, grade school age and younger. As many people probably understand, the younger a kid is, the harder it is to keep them away from you. So we're seeing a lot of preschool cases, grade school once you get to middle school and high school, there seems to be a little bit of a protective factor until you get to sports. So in the classroom, kids are fairly safe. And there's research coming out that confirms this as well. It's not just us saying this. Like there's a lot of people that are seeing this right now. But where we're getting a lot of contact are sporting events. And so wrestling and basketball currently are inside. So that allows for a lot of opportunity, and they're very close contact sports. So that does allow for a lot of opportunity for transmission. And not every county has mask mandates. So that means that sometimes they're playing against each other without masks. So that's an even more increased risk. And then you've got them riding home together in vans and buses. So socialization and activities really are the things that are causing a lot of our outbreaks. They're causing a lot of our cases. That's why we recommend, if you're going to ride in a car with a bunch of people, even though it's cold outside, roll down a window, get that airflow. Don't put your car through the recirculating air, have fresh air in your heater system, things like that. These really are things that make a difference. Even though you may think that you're fine because you see these people all the time, you don't know who they saw outside of you.
Yeah, there's an article in the Wall Street Journal this weekend talking about the learnings from the NFL, and ventilation was one of the learnings inside of that too.
Yeah.
A lot of data out of there. Okay, thank you, Jenny, for that. And just any update on vaccine from your perspective and how it's going and what you're seeing?
Yeah. So we in Douglas County just had our first big vaccine clinic last Friday. And we put through about 1,200 people in one day, which was really exciting. We have a drive-through clinic that we have worked out on our fairgrounds with the city to put together. And we think we can probably do that as soon as we can get the doses, we will get people in. So we have the alerts and people sign up via text or with our senior resource center right now, since we're in 65 and plus. And our next clinic is scheduled for tomorrow afternoon. So we think we can go through another, I want to say we have another 1,200 doses, but don't quote me on that. But whatever we get tomorrow, we will have distributed by 4 o'clock, I think.
That's great. Good, quick turnaround there.
Yeah, we do not hold on to doses. We want to get them to people that want them as quick as possible.
Yeah, and there's no reason if we had enough, you guys would be popping them out 1,200 a day.
Exactly. Yeah, and we don't hesitate. We don't want anyone to feel like they're being left out. We're trying to get as many through as possible. Same thing, Lawrence Memorial has a drive-through clinic. So when they get their doses, people are notified. And then the next day they run everyone through their drive-through clinic about as quickly as we are. So
that's great to hear. Let's pass over to Sarah. Sarah, can you give us an update from the hospital side?
Yeah, sure, John. Thanks. I'm Sarah Gideon. I'm with the Health Innovation Network of Kansas. And we'll be talking about hospitals within our 20 plus county region. As John has said in the past, we talk about staff, and space. We are still seeing some staffing challenges within our hospitals. We still have a need for nursing, especially night nurses. We're also seeing a need for environmental services staff. Cleaning those rooms is as important as taking care of the patients. And it is a challenge. So, but it's a good challenge. It's a great way to be part of taking care of your friends and community. But those are some areas where we're seeing some staffing needs. Most of our hospitals, they've seen a leveling in our PPE needs and the supply chain. However, they're still seeing some things that are slightly harder to get, like the specific sizes of gloves or the specific types of gowns. We have seen a slight decrease in the needs for beds, as John talked about earlier. This does change on a daily basis. One hospital in our region reported being this morning at 100% capacity for their critical care for ICU and about 80% in their medical beds. So we do see some flex in that. We're not on the knife's edge that we were a couple of months ago, but we still have to be aware of that. In November at Stormont Vail, we were seeing upwards of 120 COVID patients in beds at a time. Now we're around 45 to 50 on average a day. So that really has helped a lot. We still see a lot of patients that have a lot of other needs though outside of COVID. We really do continue to see cases that are decreasing. John, as you pointed out, and Jenny as well, there's some question, is that the decrease in testing? Is that a decrease in just the cases that need to be tested? Either way, we're super thankful for community members that are doing their part right now, that are continuing to do the things that are important to this. And that's, wearing your mask, maintaining your distance, washing your hands, being selective with your social engagements. So please keep doing that. You're doing an awesome job, and that helps our hospitals out so much. Vaccine wise, we're really seeing a number of doses getting out across this region to our phase 2 recipients. Each county is able to say who that goes to first and what their what their dynamics are for getting those out. They are being allocated by county. So when Jenny says 1,200 in Douglas County, that's based on their county size. Another rural county may only get 100 in a week. And those doses are going fast. As soon as they get there, there's definitely on waiting lists to be doing that. So I have been really excited to see that our hospitals have been partnering with public health as well as first responders and law enforcement in our rural communities to be able to get these doses out. They're doing drive-through clinics. They're doing clinics at fair buildings, community buildings, churches, wherever they can do them safely, have the space that they need. And our hospitals and clinics are really stepping up to be part of this movement. It's something that we all feel really hopeful about. We're not just fighting the disease one patient at a time anymore. We're pushing it away and being proactive with our vaccines. And John, if I can, I just have one more thing I wanted to share. I sent you a picture this morning.
Yep.
Can you pull that up real quick?
I will.
Okay, so I had the pleasure this morning of speaking to Rudy Klopfer. He's the administrator for Eastern Kansas VA hospitals in Leavenworth and Topeka. And he shared that they've been able to put out more than 5,400 doses. That's the first and second rounds to veterans, VA employees, and their providers. They are receiving a regular allocation each week, and they really do hope to see this increase as supply increases. They do have the capacity to be able to give more when it is available. Something that he wanted to share was that they've put these "Why are you getting vaccinated?" posters up in the hospitals. And I just pulled a few quotes off of there that I thought were really great. One was, "For me, my family, and the veterans that we serve." Another was, "For the future." One was, "Because COVID stinks." I think we'd all agree with that. And the last two, "For my 91-year-old father, to keep him safe." And then, "Marines lead the way." So I thought these were awesome. I had the awesome experience of getting to work at the vaccine clinic in Shawnee County last week. And almost everyone we served that I came in contact with was either born before World War II or during. Many came in wearing veterans hats. Several told me stories about why they were there, and it was awe-inspiring. So when you have the opportunity, this is a great opportunity to do something for yourself and your family, for your veterans. We also have in our region Irwin Army Community Hospital and Fort Riley, and they are working hard to get their population vaccinated as well. So our veterans and our warriors are doing what they can. And now it's up to our communities to continue to do what they can as well.
Beautiful, Sarah. That's moving. And just great to think about being able to get to that vulnerable population. Yep. And you guys have a good partnership in Shawnee County, right? Between the hospitals and the health department. Right? Yep.
So at the Stormont Vale Event Center, which was formerly the Expo Center in downtown Topeka, Shawnee County Health Department, Grace Med, Stormont Vale, and KU Med St. Francis have all partnered to be doing doses and really trying to take care of folks in the community. I did hear my aunt and uncle that are in phase 2. They were able to get their first doses last week. They live in Shawnee County. And my old swim coach, the old swim coach for my high school. I wasn't a swimmer, but it was great to see all of the people that were there. And the coalition that has put this together has worked really hard. And they continue to as supply increases and as demand increases. It's not without challenges, not without its hiccups, but they're being responsive to the hiccups and really trying to figure out the best way to take care of those that need this vaccine.
That's great. Thank you, Sarah. Yeah, so proud of the work so many people are doing. And I don't think I hit on the positivity rate. Was down at 5.2% for the Northeast region. From a state perspective, we're 6.44%, which is the lowest since the end of September. And I can't remember if I said this or not, so forgive me if I'm repeating, but 2,500 cases a day roughly for the state during our peak, down to 650 now. Now, testing is down, and people need to remember to get tested. I just tested my whole family today. That's, one's already had it and one's a baby. So 6 of the 8 of us took tests today, and we're all negative, fortunately. But it's important to just keep testing when you think our first grader had direct exposure, and we had some sniffles around the house, so we got checked out. And just important to keep doing that when you know where the virus is, how it's spreading, and to contain it, as it's going to be a slow roll on this vaccine, and there's still a lot of vulnerable people out there. Loved your bright spot. Doesn't get any better than that. We've been sharing a little bit about some of these vaccinated frontline workers getting to go to the Super Bowl this week. NFL's doing a really cool thing there. Several from Kansas being selected to do that and cheer on the Chiefs. And so, loved your story and what's going on there. So just as a reminder, this will now be every other week. Next call will be February 16th. Please go to the website, covid.ks.gov/report-outs. Give us your email address, and we'll send you this report out along with us. We don't have Dr. Watson with us today, but he did send me this screenshot of what the board looked like earlier today. Again, you can remember when this was almost all red. This is the capacity at the hospitals for transfers. You can see it's mainly yellow and green now, which as a Baylor graduate, I'm partial to those colors. But as for hospital capacity, that's also good. So good improvement from the transfer and capacity situation as well in the state as we've been following that. We've had good news. We're not out of the woods yet. Please continue to test, take mitigation efforts. Pay attention to your local county, what's going on with the vaccine rollout, and we will keep getting you the best information we can on these regional report out calls. We'll see you again on February 16th here for the Northeast region. And Sarah, Jenny, thank you for your dedication to the cause, throwing your hearts and your whole self into it. You're a great representation of your peers out there in the community. We just appreciate your willingness to participate in these calls. So wish you all well and a happy Groundhog's Day, and go Chiefs.
Thanks, John.